One. Welcome to June, Sharae.
Oh my gosh, I know. Time is flying.
I can't believe we've been doing this for 2 months already.
Yeah, fun times.
It is, and I'm back at work. I'm heading to work today.
Good.
And out here as acupuncturists, we're told to wear no jewelry and get our hair back. And so I feel a little bit like a alien, but I am going to be treating several patients today for the topic we're talking about, which is back pain.
Oh my gosh, we every day see it every day in the clinic. So,
probably the number one reason people come to see me.
Oh, for sure. Yeah, I agree.
Yeah, so I mean, obviously this vast upper back, lower back injury, illness, internal medicine, which we're not going to get into today, but you were going to talk a bit about what we do with the upper back and the low back, but one of the techniques we use.
Yeah, so a lot of times I like to cup. I like to cup to open up the channels prior to needling. And if you don't know what a cup actually looks like, there's so many various forms, but this is a glass cup that I use. Our clinic doesn't allow for fire cupping, which is actually lighting the cup, removing the oxygen. So we use these ones with just a pump, and then you just basically suck all the air out, and then your skin or muscles get suctioned out, and it just helps relieve some of the tension. So I like to cup prior to needling, and especially the upper back, because that's where most of us, especially women, hold all our tension in, you know?
And I've had a lot of patients describe to me that cupping just feels like a massage, but it's the reverse.
The reverse.
Right? We're lifting fascia and muscle away from each other, and we're opening up those adhesions.
Yes.
And, I always cup before upper back also.
Totally. Yeah. Same. Yeah. Awesome. But then the low back is also one that.
Yeah. So for low back, do you see a ton of sciatica? Because I see a ton of sciatica.
Yeah. Piriformis, sciatica.
Yeah.
Men.
A lot of people come in and they've got pain in their glutes or down their hamstring and in their hips. They don't realize what's causing it. It's often coming from the low back. So I think we probably both agree you need to be bold with your acupuncture. I mean, obviously we're careful, but we go right in close to the nerves of the low back. I don't actually go onto a nerve, but I like to use E-stim and get the points in the L4, L5, S1 area.
For sure.
Right, and get that nerve firing properly, because the reason the pain's there is if it's piriformis or sciatic nerve is your low back nerve root is telling that nerve to fire when it's not supposed to.
Exactly. Yeah. And in between treatments, I always recommend using a tennis ball. Just to get right in there.
Yeah, and heat. And I mean, through some of the sports medicine stuff, we talk about, I mean, a lot of people have probably heard of needling done at a physiotherapist.
Right.
Which is more, we talk about trigger points, so points in the muscle that send referral pain out. And in acupuncture, we talk about motor points, which is very similar, but we can tell a whole muscle to let go by using the motor points. So there's that very famous sciatic point in the hip, right? People hate it and they love it.
They love it. I know. Yeah. The sooner that you take care of it, the faster the results.
Yeah, it's chronic.
So unforgiving.
It takes forever. And I mean, there's age-related stuff that goes on in the low back. So strengthening your core and making sure you have a safe stretching program, I think, is vital. Like, you can't just go to physio or chiro or massage or acupuncture and then go home and sit down in your chair or on your couch. In fact, sitting on a couch is one of the worst things for your low back because it puts you into a posterior tilt instead of an anterior tilt.
Yeah.
So,
great.
I recommend, if you have back pain, go see your acupuncturist and be prepared to go for a while. It's going to take a little bit of time to resolve, but we can make a huge difference in your back pain.
I agree. And we can also be used as preventative medicine.
Oh, yeah.
Right?
Yeah, throw those needles in there. There's all sorts of other things going on in the low back that we are treating, and people,
totally.
Well, obviously we tell them, but you don't realize that we can change so much in your life by treating your low back.
Yeah.
What's your tip this week?
Well, I've been a huge fan of chiropractic care for years and years. Same with McKenna. And yeah, I'm going to suggest visiting a chiropractor.
You're going to say acupuncture.
Yeah, I was gonna say that.
Yeah, especially now everything's opening back up and you might have to mask up, but you can go see your practitioner, right?
Right. And I'll give a shout out to a couple that I usually refer to.
Excellent.
Mhm.
Well, we are speaking of backs and back to work, and a lot of people going back to their office type work, and maybe they've been off and haven't been sitting, and now they're getting back pain. Maybe
Yeah.
they're not even getting back pain, but it's important to take breaks from your chair.
Yes.
So no one in this life seems to be without technology like a phone or a watch. Just set a timer, get up every 15 minutes and stretch that back, walk around, do a couple of yoga poses, which I can give a shout out to, and just don't sit. Sitting is the ultimate evil along with sugar.
Well, I've been seeing patients that are actually working from home in bed or at their kitchen table, leg up.
Yeah.
And
Yeah.
it's, yeah, be mindful, people.
Yeah, be mindful of how you're sitting. I'm going to uncross my legs right now. Sit up tall. Awesome. What do you want to talk about next week? Or what are we going to talk about next week?
Let's talk, or 2 weeks.
In 2 weeks. Sorry, we're going to bi-weekly now. That's both working.
Let's talk about digestion.
Yeah.
Yeah, let's touch on that a little bit.
I think that's a good idea.
Mm-hmm.
Okay, well, you have a great day at work.
Yes, you as well.
Awesome Winnipeg weekend.
Thanks.
Talk to you in 2 weeks.
Yeah, you bet. Thanks.
Bye.
Bye.